Today I'd like to have a short chat about prostate cancer. Now, prostate cancer is the most common male cancer. About 40,000 men a year are diagnosed with the condition, and it kills one man every single hour. So, first of all, what is the prostate? Now, it's prostate, not prostrate. That's a mistake many of us do make. The prostate, it's a gland about the size of a walnut, which actually sits underneath the bladder. And it produces the fluid, the seminal fluid, to provide nutrition to the sperm, which are produced from the testicles. But as men get older, things happen to the prostate gland. It often increases in size without being cancer, and that's called benign growth, benign prostatic hypertrophy. And there's also prostatic cancer. Prostatic cancer is a cancer that usually is slow growing, and it occurs in men. It's very rare in men under 50, and the average age of diagnosis is between 70 and 74. So age is a risk factor. It can also be linked in about 10% of cases to your family. So if you have a father or a brother who has had prostate cancer, you may be at increased risk, especially if they were diagnosed under the age of 60. And also, if there's breast cancer in your family, in the females, then you may be at increased risk if those relatives have an abnormal gene known as BRCA1 or BRCA2. That increases the men's chances in the family of getting prostate cancer. Now, also, of course, what you eat can increase your risks. It's very important to eat plenty of fresh fruit and veg, especially tomatoes. Tomato skins contain a substance called lycopene, which can reduce the incidence of prostate cancer. It's important you follow Mediterranean diets. Nuts are good, Brazil nuts with selenium in, and it's also been found that olive oil can help. Keeping your weight down is very important, and doing exercise as well. Well, now, what are the symptoms of an enlarged prostate? Well, passing urine during the night, frequency it's called. Now, you might be getting up 2 or 3 times a night, and that frequency develops into the day. You might get an urgency, you just got to go when you want to go. You might find the urine you're passing is a weaker stream. You might feel that your bladder is not emptying fully. So if you're getting those symptoms, it means your prostate is probably enlarged. It may be benign, non-malignant, or it could be prostate cancer. So you go and see your GP. He might test your urine, see if there's an infection there, and he may then do a blood test called a PSA test, prostate specific antigen, and if that's raised, that could indicate that you may have a prostate cancer. You may examine your back passage, and that's an examination, digital rectal examination, to feel the prostate gland. Is it swollen? Is it hard? Is it craggy? Is it irregular? And you may then be referred to a specialist, and then depending on what he finds, they will decide on treatments. Treatments for prostate cancer can be hormones to combat testosterone. There can be radiotherapy, tiny little seeds put in the prostate gland. There can be surgery. But for many men, there's no treatment. There's what's called active surveillance or watchful waiting. Now, what's that? That's where the doctors watch your PSA levels, because in many men, prostate cancer is very slow growing. For example, they did post-mortems on men aged over 90, and they looked at their prostate glands, and 90% of those 90-year-olds had cancer in their prostate glands, but had no symptoms, and the prostate cancer hadn't killed them. President Mitterrand of France was diagnosed with prostate cancer, and he had it for over 15 years. Didn't trouble him whatsoever. So if your specialist says, look, we're just going to watch this, keep a close eye on it, don't worry. If your PSA starts going up, then the specialist will intervene.